I'm Ryan Elsbiston, the Chief Legal Counsel in the Office of the Governor. And we'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us again today. 1 year ago, on March 12th, I declared our first public health emergency for COVID-19. At that time, there were still so many unknowns, not only in the nature of the virus, but what it would mean for our families, our workers, businesses, communities, and frankly, life as we knew it. This past year has been challenging and unrelenting, and folks have spent it worrying about the health and safety of their families and friends, worrying about finding work or being safe at work, worrying about the future of the business they built from the ground up, and worrying about making sure that they could keep the light and heat on at home. Sure hasn't been easy, and we never could have known that the toll this pandemic would take and the tragedy it would bring, especially for the families and loved ones of the 6,524 Wisconsinites who died from COVID-19 this year. And with those we lost in our hearts and in our minds, we are beginning to see the light at the end of the tunnel. We continue to expand and grow our vaccination program, and every day we are closer than yesterday to recovery. More than 1.7 million shots have been administered, with more than 1 million Wisconsinites having at least one dose, and another more than 610,000 having completed their vaccine series. And Wisconsin continues to be a national and regional leader in getting vaccines in arms. Just as it has been since day one, this has been an all-hands-on-deck effort, and I want to take a moment to thank the countless dedicated Wisconsinites for their good work to get us through this past year. From the community leaders and good neighbors who have looked out for one another, to our folks at the Wisconsin National Guard, Wisconsin Emergency Management, and DHS, who jumped into action and haven't slowed down since. The partners in our local county and health departments were great. And of course, the nurses, doctors, healthcare workers, and providers who continue to serve on the front line of this pandemic, distributing vaccine and providing care and comfort to our loved ones battling the virus. So on behalf of Kathy and myself and the entire state of Wisconsin, thank you. Let's continue to work together to fight every inch together, and let's recover together. And as I've said, our vaccine distribution continues to expand and grow across the state. I've had the pleasure of touring and talking with frontline healthcare workers at vaccination sites across the state, from Janesville to Manitowoc, and on Monday I stopped at UW-La Crosse for the opening day of our second community-based vaccination clinic. Overwhelmingly, our providers are ready and eager to get shots in arms, just as much as Wisconsinites are ready and eager to get them. And today we announced we are once again expanding eligibility for the vaccine to another substantial and critical group of folks, including those with pre-existing conditions, which Deputy Secretary Julie Wilms and Dijk will expand on in just a moment. But as I have mentioned before, we are now entering a new and unique phase of our efforts against this virus, where we have some Wisconsinites fully vaccinated, others partially vaccinated, and a whole lot of people waiting patiently for their turn. That's why I can't stress enough how important it is that we continue to follow the science and recommendations from our public health experts. That includes the CDC's recommendations that everyone, fully vaccinated or not, continue to wear masks and practice social distancing whenever we are out in public, and to avoid large gatherings with multiple households. Because folks, the virus has not gone away. The new variants of the virus have arrived. We can't afford to lose ground this late in the game. So please continue to take precautions to keep your families and friends safe. Continue to be cautious and thoughtful about how and where you gather and who you gather with. And please continue to wear your mask to protect the health and safety of our unvaccinated friends and neighbors. We are ready to turn the corner. We are ready to kick this pandemic to the curb, and we are in a great position to do it, and we're not going to give up now. With that, I will now turn things over to DHS Deputy Secretary Julie Willems Van Dyke. All yours, Julie.
Thank you, Governor, and good afternoon, and thank you for joining us today. So in Wisconsin, 1,837,890 doses of COVID-19 vaccine have been administered to date, with 660,589 people completing their vaccine series. Please note that as of this week, a completed series means either 2 doses of Pfizer or Moderna vaccine or 1 dose of the Johnson & Johnson vaccine, which we've begun to administer in the state. We continue to be one of the top states in the nation when it comes to vaccine administration. Over 10% of our population have completed their vaccine series. Over 19% have received at least 1 dose. And nearly 65% of people 65 and older have started their vaccine series, and 1/3 have completed their series. This is incredible progress, made possible thanks to our network of vaccinators and the increased vaccine supply we know is on the way from the federal government. To build on that progress, we are announcing more eligibility groups in the coming months. Starting March 29th, we are expanding eligibility for the vaccine to Wisconsinites age 16 and older who have medical conditions that increase the risk for severe illness, hospitalization, or death from COVID-19. These medical conditions include cancer, heart or lung conditions, and diabetes, as well as people who are immunocompromised, overweight or obese, or have high blood pressure. You can find a full list of medical conditions for this eligibility group by going to our website, dhs.wisconsin.gov/COVID-19, and clicking on the photo labeled vaccine. Our decision to include these medical conditions was informed by the work of the state medical our medical advisors. It is based on the best evidence we have about which medical conditions make someone more vulnerable to severe illness or death. Expanding eligibility to include Wisconsin residents with these medical conditions will mean increasing the eligible population by more than 2 million people. Just like previous expansions, everyone who was previously eligible will continue to be eligible and receive priority. Because of the sheer number of new people in this new expansion, healthcare providers may need to sub-prioritize within those groups and may consider factors as people with severe or unstable conditions, racial or ethnic groups, older age, or those with multiple conditions. Each week, in February and March, we have seen our vaccine grow, and even more vaccine is anticipated as we move into April and May. We are moving quickly on the vaccination of educators and can now encourage all groups who became eligible on March 1st to seek out vaccine through pharmacies, community-based clinics, local or tribal health departments, or their healthcare provider. So grocery workers, transit workers, utility workers, we encourage you to get vaccinated. With this anticipated increase in vaccine, we anticipate that Wisconsin will be able to open up eligibility to all residents age 16 and older by sometime in May. All of this is very good news, and we also have to remember that COVID-19 is still very present in our state, and we have to each do our part to stop the spread. We are adding 502 new cases today, which brings our total confirmed cases of COVID-19 to 568,352 people. Our 7-day average of cases is 363. Our total number of COVID-19 deaths has reached 6,524, although we are reporting 0 new deaths today. Our thoughts are with the families and friends who have lost loved ones, and we must recommit to wearing a mask, physical distancing, washing our hands, and limiting our interactions to the people we live with. If you are fully vaccinated, meaning it's been at least 2 weeks since you completed your vaccine series, you can check out our vaccine webpage to learn more about guidelines for visiting with other fully vaccinated people. But please remember that we all, vaccinated or not, need to continue wearing a mask and physical distancing in public places. Thank you, and with that, I'll turn it back to Jennifer for your questions.
Thank you. A reminder to maintain audio quality. Please keep phones on mute until it is time to ask your question, and you can use *6 to unmute your phones. As we do need to wrap up by 2:15 this afternoon, in the interest of time, please only one question per reporter per media outlet. And we'll begin this afternoon with AJ Bayatpour from WKOW-TV in Madison. AJ?
Good afternoon. Thank you for taking the call. With upwards of 2 million people potentially now becoming eligible with this decision, what about other groups who have been asking about their eligibility? For instance, people who work in the manufacturing sector.
So I think, first of all, 2 things. One is everyone's going to be eligible in May, and that's the biggest message I want everyone to hear at this point in time. We have seen a significant increase in vaccine over the last 2 months, and we'll continue to see that increase according to our federal partners. And that means we don't have to do this continuous staging group by group by group. That's why we're opening to a much larger group here, and then everyone in May. And so what I would say to those who haven't been included yet is, first of all, the group with chronic conditions represents 60 to 65% of Wisconsinites. So please have your employees who have any of those conditions seek out vaccine once they become eligible on March 29th. And then as we look forward to May, we encourage our employers to be thinking about how they might host vaccine clinics on site for their employees, because we want everyone to be getting vaccine as we move into those months so we can achieve community immunity as soon as possible.
Thank you, AJ. Now to David Wahlberg from the Wisconsin State Journal. David.
Yeah, thank you. How do you plan to distribute doses meant for the group with the chronic diseases? Should they be mainly seeking vaccine from their healthcare providers or from the other places like pharmacies and community clinics?
All of those options are viable options for people in these groups. We do know that a number of our healthcare systems have been eagerly awaiting this phase as well, too. And through the modern miracle of electronic health records, we'll be able to identify patients with these conditions and reach out to them, very similarly to how so many of our health systems reached out to their patients who were 65 or older. So many people may hear from their healthcare providers as they work through triaging patients in their care with these conditions. But in the meantime, just like with all of our other eligible groups, we've made many avenues available for people, and you will be able to go to a pharmacy, to a community-based vaccination site, to a local health department, to any of our vaccinators who have vaccine available, make appointments and receive vaccine. You will simply need to attest to the fact that you have one of those conditions, and vaccine will be provided to you.
Thank you, David. Now to Stephanie Hoff from WisPolitics. Stephanie?
Good afternoon. Thanks for taking my call today. So the messaging from DHS and other vaccine advocates is one of these vaccines is better than none. But I'm curious if you've heard reports of people declining the Johnson vaccine because of its lower efficacy rate. And this whole thing, I mean, like with the flu shot, are there multiple brands of flu shots that have different efficacies? And are people going to start getting picky about their shots?
Well, I'm going to turn to Dr. Westergaard about that, but what I can tell you so far is I have not heard any reports of anyone refusing a given shot. But Dr. Westergaard, comments about different...
Likewise, I've not heard that there's of any specific or groups of people who are refusing any of the vaccines, and I think the message about how we think about the different data, the different evidence that we've collected about the vaccines is important to talk about. We have 3 different vaccines that were shown to be vastly superior to placebo in carefully conducted trials in multiple countries around the world. So that's the bottom line. We have multiple effective and safe vaccines. The other thing to know is that with respect to the most important outcomes, the deaths and hospitalizations due to COVID-19, all 3 of the vaccines were virtually 100% effective. So there was very little, there's no variation among the trial participants in preventing those most severe outcomes of deaths and hospitalizations. So everyone should feel good about that. We don't have any evidence that one vaccine is superior to another based on head-to-head trials. And that's really the level, the standard of evidence that we require in medicine to make a recommendation of one treatment over another or one vaccine over another. These studies were done at different points in the epidemic, in different countries, with different methods for how they enrolled participants and how they ascertained outcomes. So similar to influenza, where there are multiple products, where they're studied in clinical trials in different populations at different times, when we have safe and effective vaccines, we recommend that people use them, and we don't make a determination or a recommendation of preferring one over the other.
Thank you, Stephanie. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina. Fox 11.
Hi there, can you hear me?
Yes, we can. Go ahead, please.
Alrighty, thank you. So my question is an update on the Johnson & Johnson vaccine. If there's any update on future allocations for the weekly allocation that Wisconsin may be receiving, and as you mentioned, they've made it to Wisconsin. Where are they in Wisconsin? How are they being distributed? Thank you.
Sure. We don't have any further update other than what we received when we received our first allocation, which was not to expect any for the subsequent weeks in March, and anticipate that by the end of the month, early April, we'll start to receive a steady supply. So that continues to be the news that we've received from the federal government. In terms of the vaccine, we received 48,000 doses of the vaccine. Those are all being distributed, being shipped as we speak, and in fact arriving in vaccinators' offices now. And they have largely been focused on our vaccination of educators, but they've also been put into the mix of vaccine distributed alongside Moderna and Pfizer vaccine, and will continue to distribute it as one of 3 highly safe and effective vaccines going to our vaccinators as part of our general allocation strategy as we move forward.
Thank you, Katrina. Now to Heather Poltrock from WSAW-TV in Wausau. Heather?
Yeah, hi, this is Tony filling in for Heather here. So with so many people in the next group, talk about the role the mass vaccination sites are going to play in getting everybody vaccinated. Thank you.
Great question, Tony. It's exactly why we're working very hard to have those mass vaccination sites set up across the state. We have a number of community vaccination sites, the 2 that the governor referenced that the state is providing staffing to, but a number that will be having staffing from FEMA, and a number from our local health departments who are diligently working alongside in this incredible effort to get shots in everybody's arms. So we are working on placing sites throughout the state to make it a shorter drive time for everybody to be able to get to one of those sites. Also working on the rollout of our Wisconsin vaccine registration system so that people can easily log into that system or call in to our toll-free number and register for a vaccine at one of those sites. They will be very important to supplement the good work of our healthcare system. But when we start talking about hundreds of thousands of vaccines a week being delivered, and remember, when I talk in first dose vaccine, so when I say 200 to 250,000, that means first doses, new people coming into the system, double that for the number of people who will need a second dose who are receiving Pfizer and Moderna vaccine. So we're talking about 400,000 to 500,000 doses a week in the coming weeks. We need all hands on deck because this is going to be the point where there's lots of vaccine and lots of demand, and we need lots of vaccinators administering it. And so we are preparing for that and very excited that in the months of April, May, and June, we are very hopeful we'll be able to vaccinate everyone in Wisconsin who wants a vaccine.
Thank you. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, thanks for taking my question. Governor Evers, when you were in Manitowoc, you had mentioned that you intend to extend the mask mandate before it expires next week, I believe. My question to you is that do you believe this will be the last time you have to extend the mask mandate? And when will we, be able to see things kind of start to open up in terms of, the regulations and the suggestions for masking, so on and so forth, to go away in the state? Thank you.
Thank you. And just to correct myself, what I said in Manitowoc, the actual mask mandate ends early April. And at that time, we'll take a look at what the transmission is doing across the state. And hopefully, and this is what we see across the country, is somewhat of a plateau instead of a decrease. So we will take a look at it in early April and see how that looks. And if it looks like we need to have another push around masking, we'll do that. And there are many unknowns, obviously, in this race to end the pandemic. And what everybody at this table, and frankly everybody across the state, believes is that the last thing we want to do is make sure that we let our guard down on issues around mitigation when we're kind of at the finish line, and that would be we don't want at some point in time having to push out that finish line because we have decided to not mitigate when we should.
Thank you, Rob. Now to Mike Spalding from TMJ Radio in Milwaukee. Mike? Mike Spalding from WTMJ Radio. And we have to move on then to Kelsey Dickinson from NBC 26 in Green Bay. Kelsey. NBC 26. Okay, we have to move on then to Scott Bauer from the Associated Press. Scott?
Yeah, hi. Thanks again for doing this call. I'm hoping someone could walk me through the math a little bit. It seems like 2 million would be a low estimate for how many more people are eligible. Based on DHS data, nearly 70% of Wisconsinites are overweight. So even just the adult population, we're talking 3 million plus who are just overweight, let alone high blood pressure and everything else. So can someone tell me how you arrived at the 2 million number? And isn't this really basically opening it wide open at this point?
Well, Scott, I can speak to that a little bit, and if Dr. Westergaard wants to add. We're saying more than 2 million. It is hard to predict exactly how many people it is. Many people with these conditions may have more than one of them, and so there's crossover. The other thing is we've already vaccinated over 1.1 million people, of whom they also have a number of these conditions. So of the total people in this group that would be eligible, a whole bunch of them are already done. We don't know that precisely either. So we're saying over 2 million. Maybe it's closer to 2, maybe it's closer to 3. The point is, these are all people who are at risk for the disease, and we want to get them front in line before we open to the full population. And more vaccine is coming. And that is why we are moving this forward. Dr. Westergaard, anything you'd add?
Nothing to add. That was good.
Thank you, Scott. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for holding this. Wisconsin is doing better than a lot of neighboring states in terms of positivity rate and case numbers. Can any of that be attributed to Wisconsin potentially a higher immunity rate because things got worse here during the previous surges? Thank you.
Dr. Westergaard?
Is the question how we're doing better with respect to neighbors and vaccines or disease activity?
Because of prior surges.
Because of prior surges. Well, both vaccination and prior infection offer some protection against future infection. So when we talk about community level vaccination or community level immunity, both play a role. We have a lot more confidence that vaccination leads to durable protection by the immune system for a longer period of time and more predictable than prior infection, but both probably play some role. I can't speculate as to whether the relative contributions of public health mitigation, following best practices for restricting gatherings and mask wearing, and the level of immunity that's already in the population. All the three things are contributing to having our epidemic go in the right direction, and they're all things that we need to continue if we want to continue to driving it down.
Thank you, Sean. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you. The vaccine uptake disparities among racial and ethnic groups do appear to have improved somewhat, but they still remain pretty far apart. So can you update us on your status of the efforts to address that? And have you seen any indication that has happened in some other locations around the U.S. that vaccination programs set up to reach especially minority and low-income communities have instead mostly drawn people from outside those communities, maybe even coming in from other places? Thank you.
Yeah, well, I'm glad you noticed, Eric, that we're starting to close the gap a little bit, but we still have way too far to go. So we are continuing a number of efforts, and those efforts are particularly moving into community and moving vaccine closer to people who may be experiencing those gaps in vaccine distribution. We're really excited that one of our federally qualified health centers, the 16th Street Clinic in Milwaukee, will be receiving vaccine directly from the federal program and be able to expand their vaccination efforts, largely focused on Latinx populations in their community. And I just learned this morning another 10 of our FQHCs will be receiving federal supply of vaccine, and we want to work right alongside of them to help expand their staffing so that they can administer vaccine even faster to their populations. This expansion to a broader group of people is also going to help, because part of the limitation has been some of the groups that were eligible for vaccine didn't have as wide a representation of people of color in them. That's a whole nother issue we have to address, is how do we bring more people of color into our healthcare workforce, our educator workforce. But the nature of that meant we had more white people eligible than other racial and ethnic groups. So by opening up more widely, we also are creating an avenue for more people of color to be vaccinated. And last, I would say, as we work on bringing in federal assets like FEMA to assist with our vaccination clinics in a number of communities, and bring in state assets, as we are in a number of communities, our local health departments are redeploying staff to focus on populations that may be harder to reach or may not have learned as much about vaccine. or may feel more comfortable getting vaccine in a familiar setting. And this would be both racial and ethnic groups, and also people with disabilities, people who are homebound, people in shelters. And so our local health departments will be instrumental in reaching populations that may just not know how to sign up and go to the mass vaccination clinic or their doctor's office.
Thank you, Eric. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, so going back to what you said about the general public being eligible sometime in May, is there a specific amount of weekly doses of vaccine you're hoping to receive in order to be able to open it up to everyone? And are you also shooting for a specific number of people who will have already been vaccinated again to feel comfortable opening eligibility up to the general public? Thank you.
Well, what I can say is yes and yes. Those are the factors that we will look at. We will look at the number of vaccines coming into the state, the uptake that we're seeing in the populations we've already identified, and that will determine when we will do that. Generally, we have said we want to see 50% of a population group eligible before we open up to the next population, 50% of an eligible group having received vaccine before we open to the next group. Frankly, that's how we've made the decision about moving to people with chronic conditions at the end of this month. We think we will be there with the group that became eligible on March 1st. And of course, we're making great progress with our phase 1A and our people over 65. Those are the kinds of parameters we look at. I want to add just one thing to that too, is one of the challenges about how we do this statewide is that it's not even across the state. And we have places where people are finding every vaccine in their community and getting it in their arms quicker than we are in other parts of the state. We're constantly reassessing and revising our formula for distribution to get vaccine. When we see a part of the state that's getting higher uptake and other places with lower, we move a little bit of vaccine from the higher uptake to the lower uptake. But we know both of the following situations are true. People have open appointments and are saying, where are the people? We want to vaccinate more people. And people are saying, I'm in an eligible group and I can't find a vaccine to save my soul. And both of those things happen in our state right now. And what we are really hopeful for in the months of April and May and June is we'll have enough vaccine coming into the state where everybody will have an opportunity to get an appointment, no matter if you live in Madison or Wausau or Rhinelander or Manitowoc or La Crosse or wherever.
Thank you, Madeline. Now to Elise Romas from NBC 15 in Madison. Elise?
Hi there. I had a question about signing up to get an appointment to receive your COVID-19 vaccine. There are some people that had contacted us and somebody that I spoke with who said that they found the form to sign up rather confusing. So I didn't know if, as the eligibility changes, if the form changes and if there's anything that you guys are working to make more broad or even more specific as these groups of eligibility continue to open up.
So I'm not sure what form we're talking about. I'm thinking perhaps this is someone who's gone on the Wisconsin COVID vaccine registry and needed to walk through the questions on the registry to determine eligibility. So we'd love to hear more feedback about that. If people had concerns about that form, please contact us at DHS. If you go to our vaccine website, you'll find contact information there. But what I would also say is that form's going to get a heck of a lot easier when everybody's eligible, because all you have to do is put in your own demographic information and click to find an appointment. Right now, there is a series of screening questions to be sure people are eligible based on the criteria that we've had. But as we move forward, as we move into May with all populations eligible, we will strip out those questions, and you tell us who you are, and we'll get you an appointment.
Thank you, Elise. Now to Lane Kimball from WISC TV News 3 in Madison. Lane?
Hi, it's Naomi Coles in for Lane today. My question, if you could expand a bit more on clarity regarding the prioritization within these this medical conditions group. So, for example, just to use a really simplified scenario, let's say someone who's 50 years old with one high-risk condition walks into a pharmacy with an appointment or walking to get a vaccine. You have someone else who's 25 with, say, several high-risk conditions who walks in. How does that prioritization within these groups get determined? Thank you.
Well, I'm going to turn to the clinician
Sure.
in the group to answer that.
I think the first point is that subprioritization is not required or mandated by any of the vaccinating providers. It may be the case that some health systems who are systematically offering vaccine to people in their care who are part of their system may, for the purposes of scheduling, offer invitations for scheduling to people who are at particularly high risk. And from our perspective at DHS, we're not suggesting that there's a right way or a wrong way to do that, but we suggested that it would be appropriate to use some considerations, for example, the ones that you mentioned, people that have multiple conditions, people that have conditions that are severe, for example, if they've required hospitalization, if they require frequent visits for IV medication, for example, someone who has diabetes and kidney disease who is on dialysis might be a higher priority than someone who has very mild kidney disease who's not on dialysis. These are just examples of what we consider appropriate or acceptable. But DHS is not mandating or requiring that any subprioritization happen. Everyone who is eligible under this group by virtue of having any of these conditions is now eligible. And we want to work collaboratively and offer support to our vaccinating providers to do it in the way that they feel is most responsive and most appropriate for their patient population.
Thank you, and thank you, Elise. Now to Lane. Now to Ben Jordan from WTMJ, TMJ4 in Milwaukee. Ben?
Hi there. Quick question just for clarity. I know it was mentioned earlier that healthcare providers are going to proactively reach out to people based on their medical records, but what if people who have these medical conditions would rather go to a public health department or a pharmacy? Are you suggesting to those vaccinators to provide any way to verify that they have a medical condition that qualifies them for this round of vaccine?
We are not asking people to verify. We are not asking people to have to bring their medical record and prove that they have asthma or diabetes. Some vaccinators may take people at their word. Others may want them to sign some simple form that attests that, yes, I am a person who has one of these conditions. We are changing the Wisconsin vaccine registry system where you'll just have to check a box and say, yes, I have one of these conditions. And so this is not about policing this. This is about creating entry into the vaccine system for people who have these conditions in the simplest and easiest way possible.
Thank you, Ben. Now to Victor Jacobo from CBS 58 in Milwaukee. Victor?
Hi, good afternoon, and thank you again for taking this call. This is obviously kind of a moving target depending on the supply, but I guess what is your prediction of the weekly pace of vaccines happening that you believe will be a successful, marker? And with it opening up in May, are you hoping, do you have a prediction of when, we're expected to reach that 85% of folks vaccinated to kind of reach that community immunity? Thank you very much.
So right now, the state is receiving about 130,000 first doses a week, and our partners in the pharmacy program are receiving about another 35,000 doses a week. So all told, that makes about 165,000 doses per week. We're really, based on predictions from the federal government, we see that number moving up into more of the 200,000 to 250,000 first dose per week range in the months of April and May. And if that proves to be true and is sustained, and we get all those shots in arms, and everybody who is eligible for a vaccine gets a vaccine, we should be able to hit that 80% mark sometime in June. In reality, I think it's going to be a little bit harder once we get over 50 to 60%, and we may need to encourage a lot of people to get vaccines. So it may take a little bit more time. I fully anticipate that we'll be vaccinating well throughout the summer so that we can continue to make sure that everybody who needed some more time to think about this, who needed to see that their family members got vaccinated and were okay, who maybe haven't heard about how to get a vaccine, all have time to get it. So it's not like we're going to shut everything down in June. We will continue to sustain a system to continue to encourage people to come in and get vaccines. But I think the really good news is by May or June, we should absolutely have enough vaccine in this state to reach those levels that we want to reach. And so if you all can bring a friend or a buddy to a clinic and everyone brings one, we'll get there faster.
Thank you, Victor. We have time for a couple questions, and we'll continue with Nick Bohr from WISN TV in Milwaukee. Nick.
Good afternoon. Governor, it appears that this is the last priority group before the general public. The CDC recommends prioritizing another category of essential workers like restaurant workers, housing, construction, even media. Why is Wisconsin choosing to exclude them from 1C?
I'm going to pass that off to my colleagues.
Well, I think you heard the numbers in 1C, and I also would say a whole bunch of those people are not excluded because many of them would have one of these health conditions. So everyone who's a construction worker or a member of the media who has any one of these health conditions, you are now included. And if you're lucky enough not to have one of these health conditions, you will be lucky enough to be included in May. We still, I know we're being encouraging about the vaccine supply, but we still don't have 5.8 million vaccines or even 4.6 million vaccines, which is all the adults. So we still need to do a balancing of people most at risk with vaccine supply, and that is why we are making this decision. The people with these health conditions are at higher risk for disease or death, and that's why they are moving to the front of the line.
Thank you, Nick. And our final question this afternoon belongs to Jonathan Sadowski from Up North News. Jonathan?
Hey, thank you. This question is for Governor Evers. Obviously, President Biden signed the federal COVID relief bill today. There's quite a bit of money, about $3 billion coming towards Wisconsin in terms of state government, in addition to other programs like vaccines and whatnot. How are you anticipating to be able to utilize the extra funding that's coming our way?
Well, we want to get it out the door as quickly as possible to deal with the issues that are a direct result of the pandemic, and that's getting it out to small businesses, people in the child care industry, tourism industry, and obviously to make sure that our public health system is working appropriately. So our goal is to get it out the door and get it out the door, frankly, in the same way we have in the past. There's many people in the state of Wisconsin that have needs, and we have to make sure that we meet those needs. And so there will be no shortage of opportunities for us to help out the people of Wisconsin after that money comes in the door. Of course, we always have to wait for kind of the regulations and all that. That'll take a little bit of time, but once we get it, we'll be in a position to serve the people of Wisconsin, especially those who have suffered the most in this pandemic.
Thank you, Jonathan. And that concludes today's briefing. Reporters who did not get to ask a question can send those to dhsmedia@dhs.wisconsin.gov. And for more information on COVID-19, please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.